everyone, I'm Megan with the I Believe podcast, and this month is actually Brain Injury Awareness Month. So we have two fantastic guests with us from Brain Injury Services. We have Donna and Claire. Welcome, ladies.
Thank
Thank you
you.
so much.
So why don't you each take a minute to just explain what you do?
Sure, I'll kick us off. I'm Donna Meltzer, and I'm the CEO of Brain Injury Services. We are located in Northern Virginia, and we have been around since 1989. We primarily serve individuals who have a brain injury. Anybody in our area who has a diagnosis from a medical doctor of brain injury can come and find us, and we have a lot of supports and services for individuals who are on their journey to recovery. So I hope during our conversation we can talk a little bit more about what those services are, but let me turn it over to Claire because she does actually provide direct services and supports to many of our clients. Claire?
Yes, thank you, Donna. Hi, Megan. Thank you for having us. Yes, my name is Claire Callison-Aub, and I am the manager of Child and Adolescent Services with Brain Injury Services. So we have a small team of 4 of us in total who serve young adults, infancy, toddlers, children, teenagers, and young adults who are up into college who have brain injuries.
That is fantastic. So when you started Brain Injury Services, you said that was quite a few years ago. Has it changed a lot with the amount of people coming forward realizing that they have a brain injury?
Yeah, I think so, Megan. You know, the story, as I understand it from those who were really part of the movement to establish this organization, were largely a group of parents who had adult-aged children with brain injury. And I guess their concern, and rightfully so, was what's going to happen to my child when I'm gone? Who's going to take care of them? What are they going to do during their lives? What will they be able to do? What will their lives look like? So they started this organization to really delve into that. Initially, they were really looking to create more housing opportunities for their adult kids with brain injury. That is one piece of what happens, but really now we look at our community so differently. It's much broader. You know, we don't have just one program here. We have 8 different programs that we run here, running the gamut from day programs for adults who have brain injury and need a place and a space where they can go, both for socialization and that idea of feeling like they belong somewhere and that they have friends, they have a group again, but also so that they can learn or relearn skills that they need so that they can go back into the workforce or doing whatever it is in their life that makes them happy. So we have those programs. We have adult case management. We have the pediatric case management, which Claire mentioned. We have vocational services supports, and we have mental health support, which is a really big way in which we're growing right now. I think, as you can imagine, in today's world, when who doesn't need some help, right? You know, processing what's going on in our world and in our lives, particularly for people who are impacted by brain injury, they need to talk with somebody as well. We also provide occupational support and therapy and just a whole host of ways that we help people along the way with their journey and getting back to building the life that they want to live.
That's fantastic. So one of the things that I thought was very interesting when I was talking to Claire was that some people might not realize that they have a brain injury or that they qualify as having a brain injury, and there might be services that they are eligible for, but they wouldn't know about it. Tell us a little bit about that, because I feel like that is kind of a huge deal.
Yeah, it is a huge deal, and Claire's absolutely right. You know, people who go to see their doctor because they have maybe a TBI, traumatic brain injury, they know they have a brain injury. They have had either a car accident or a fall, something that was a really defining moment, right? And so they know that something isn't right, and they're going to go see their doctor, and then hopefully it is their doctor or somebody at the hospital who will say, oh, by the way, there's this place called Brain Injury Services, and you should give them a call because they can help you on the next step of your journey. But there are a lot of people who might not think about what's just happened to them. So, for example, concussion is one of those things, right? Concussion is incredibly common. I think when we think about concussion, yes, we think about somebody being hit on the head. We often think about those who are athletes, but sometimes the concussion is just very simple. Maybe it's from an accident, or you got hit on the head by a ball just being outside playing in the backyard. Sometimes parents will see that and they'll say, "Oh, I should go see the pediatrician with my child and see what they have to say." Others they just kind of get up and say, "I'm fine." Right?
Mm-hmm.
Nothing's going on here. And so they just go on about their day. But later, other things may start to happen.
Mm-hmm.
And that becomes problematic. And so it becomes a repetitive kind of thing. I can't tell you how many clients we talk to who will say, "Oh, I just had another concussion," or "I had another TBI," or "I fell again and I'm back here because this happened again." And so that's part of the beauty of the services that we provide is it's not time limited. People can come back time and time again. They might have great progress and go back out into the world, and then something happens again. And they need to hopefully not start from ground zero, but maybe pick up, or just kind of pick up on where they left off, or get started again with some support so that they can get back to their life again. Claire, you brought that up for Megan. Did you have some experiences or situations that you wanted to share?
With regards to concussions, yes. So I had a client, actually, I used to work as an adult case manager before I was a pediatric case manager. And one of the clients that I worked with, she actually came to us because she had multiple concussions and she didn't realize that she was actually misdiagnosed with PTSD. And it wasn't until she saw a neuropsychologist, and he was the one who tested her and found out through her history, because she was in and out of foster care homes and was involved in a lot of gangs, that she had multiple concussions from the violence that was around her. And so it was her neuropsychologist who referred her to us because he knew about us. And she just had this aha moment when she realized that her issues were not due to PTSD, and that's why none of the treatments were working, but were actually indeed due to these multiple concussions that she had throughout her childhood.
Wow, that is so crazy that a concussion symptom could mirror a PTSD symptom. I wouldn't personally think that
Yes.
those would be similar symptoms, so that's fascinating.
Megan, there's so much we don't know about concussion. In fact, for the last year, we at Brain Injury Services have been embarking upon a year-long effort around concussion. A year ago at this time, we did some polling in Northern Virginia of adults to kind of figure out what they knew about brain injury in general, and how they might support a loved one, or what might they be concerned about if you had a concussion or a brain injury of another type and you went back to work, or your child was going back to school. And we learned a lot from that polling data. One of the things that we learned was that most people were not relating concussion to brain injury,
Mm-hmm.
and they didn't know enough about concussion and what to do if they or somebody they knew had a concussion, and what the basic protocols even were. So we did a deep dive into that this year. We hosted a summit back in September where we brought together a bunch of leaders, not just from the Northern Virginia community, but also from our federal government, from the CDC, some doctors with deep credentials in concussion, as well as leaders in athletics and schools and all kinds of areas, so that we could really explore this more. I'm excited to share that we have a report that will be coming out this month for Brain Injury Awareness Month. We're getting ready to release that later this month, actually on March 25th. We will be doing a webinar to release that report and to talk with some of our experts about concussion and how it is brain injury, what it might look like, and what people should know after having a concussion.
Castle Biosciences is a proud sponsor of this I Believe podcast. Castle's innovative uveal melanoma tests provide valuable information about the risk of your eye cancer spreading to help you and your healthcare team individualize the management of your disease. To learn more, visit castlebiosciences.com.
That actually is what I would love to ask you about next. So, in our community, we have a lot of vision issues. So ocular melanoma is melanoma in the eye, and most of our patients will either lose sight completely in their eye or at least very severely impacted. So falling is definitely a common occurrence.
Yes.
So if somebody is to fall and they've hit their head, when do they need to seek treatment? What are the signs that they should look for if they think they might have a concussion?
I think that anybody who has had a fall like that, particularly if they're struggling to get up after the fall, if they feel like they're spinning, if their vision feels impaired, it is imperative to see your doctor right away. I think, and one of the things that we heard from our experts during our concussion discussions was that's number one. Don't just sit there and think, oh, it's nothing, it's not a big deal. I fell down, I'm okay, and just brush it off. Go get checked out because sometimes the symptoms show up later. We have a client, or a former client, I should say, really, who his experience with concussion was such an everyday story, right? He was in his house and he was walking down the stairs, and it was sort of a narrow space between the stairs and where the ceiling, a slanted ceiling was, and he hit his head on a beam and he fell. And so at first he thought, I'm okay. He got up, and next thing he knows, he's passed out, right? So he has had a very long journey of recovery, and it's been up and down because this was truly a serious concussion that really impacted him. And he has told his story to all of our staff and some others as part of our concussion campaign. He can even describe how it felt for him with his vision, like he would lose some of his vision, maybe temporarily, it would come back. And he said it's like being in a fishbowl or driving along a highway and things are whizzing by you, but you're really sitting still. So I think there probably are a lot of commonalities in, how different head injuries can impact your vision. But I think the number one thing that we would all say is don't hesitate. Go get checked out. Let your medical professionals determine what's really going on.
Yeah, so important. If you're ever on the fence, just go and get checked out. And I think,
right?
Yeah, with everything.
And that's something that we talked a lot with some of the leaders in the schools in our area about. Claire, I'm sure in your work with children and with teachers and school personnel, you come across all the time is schools have some united protocols in terms of concussion, and some are constantly in flux with it or changing how they're looking at things. Often I think when a student has a concussion, they are sent home with a note, and we've been kind of looking at this concept of, right, no technology, be in a dark room, maybe you need to be there 2 or 3 days. And now there's some other school systems that are working with their counties and their health professionals that are saying, well, that's a little old school now, right? Because we kind of cycle through these things quickly. And they're saying that might be right for some people, depending on the severity or the level or the type of concussion they had. For others, they might need to get up and walk around. Maybe they shouldn't be staring at a computer, but they might be able to, take a walk, get some fresh air, engage with family or friends, and not feel like they need to have these 3 days of sort of solitary confinement, if you will. So I think it's important to know that protocols are continuously changing because the science is changing, and we know so much more. Almost every year, we learn more from science and research. There's better testing, better evaluations. And so our procedures and the way we react to whether it's concussion or, traumatic brain injury, something that has happened, we can address it differently now.
Yeah, that makes a lot of sense. And I know when I was a kid, the football players would get concussions, and we would always just like, oh, he's got a concussion this week, or this one's got another one. And it was very talked about, like,
It's almost like a badge of honor, wasn't it?
Yeah, and like, oh, I got another one. Like, it's not a big deal.
Yeah.
My son just turned 13, and he was playing volleyball with a friend, and they collided, and her front teeth actually broke on his forehead. We took him to the ER because we thought he might need stitches, and he didn't. He just needed a little bit of glue. But the first thing they did was a concussion test.
Yeah, perfect.
And I as the mom who brought him to the hospital, was like, oh, I didn't even think concussion. I went straight to stitches.
Mm-hmm.
But I was so glad that we brought him in to have the stitches looked at, because it didn't even occur to me concussion. And luckily he didn't have one, but I was so thankful that they knew to check him for it, because that was not even on my radar.
Right.
Yeah.
There's so many different ways that concussion can happen that we don't always think about. And I want to mention for your audience something that we didn't really know about until last fall, but I find it incredibly frightening and really astounding. And it's something that people are doing. Mostly we see it in videos on social media, and it's called power slapping.
Oh, yeah, yeah.
That sounds awful.
Well, I'd never heard of it. So we started looking at these videos, and it's basically two individuals who are doing this like a sports championship, right? And they stand up and they are face to face with each other, and they take swings at each other. And they're basically trying to knock the other one down. So not like in professional wrestling or boxing where there's headgear that's worn. They're just purposefully trying to knock the other one out in the head. And I really struggle with this fact that in 2025, when we know so much better and we know how dangerous a concussion can be, why would we do that? I mean, it's perhaps not so different from domestic violence, where we also know that many people are injured in the head, particularly women, and they show up often in the ER or in their doctor's office, and that too can be severe concussion that can lead to lifelong brain injury.
That's shocking.
Yes,
Like,
it is shocking.
like Tide Pods.
And we all should be incredibly shocked by something like that it is purposefully done. It's a game. And when we saw that, we're like, oh my God, how can people do that?
I have no idea. That's ridiculous. Wow. All right, guys, don't slap each other, please.
We won't, I promise you that.
Yeah. Wow. That's crazy.
Yeah. So, brain injury is something that can present in different ways, whether it's through a stroke, heart failure, heart attack, power slapping, a fall, car accident, bumping your head on a beam. It happens in a multitude of ways every single day. Every single day, somebody else is diagnosed. I mean, honestly, it's like every 30 seconds, somebody is diagnosed with a brain injury. And we have a lot of work to do to change that for the better, we hope, through prevention, through a lot of education, through research, which hopefully will lead to more testing, and through better protocols of understanding what to do when a brain injury actually happens, whether it's a child in school and the school needs to intervene, or it's somebody who it happens to at work. And, we hope that whoever is in that same office or workplace can help. We hope that people who are doing manual labor, like the incredible people you see fixing our lights and our roads, and they wear helmets all the time. Not that we all need to walk around with a helmet, but if you're working around, heavy materials, our veterans, of course, we serve veterans as well. We partner alongside the VA in supporting all of our veterans in Northern Virginia who need maybe beyond what the VA can supply for them, or in addition to, right alongside with them. But so many of them have, of course, experienced TBI, and we're here for them as well to help them get their lives back together. So, we'd like to eventually not be in business anymore because nobody has a brain injury, but that's not the reality. So,
Same here. We'd also
Yeah.
like to be out of business.
Of course.
Yeah.
Of course. Yeah. We all would, right? If only we didn't have to, support whatever illness, injury, disability occurs because it just didn't happen. But it's a real part of our lives, and we're happy to be here supporting individuals and their families through this time.
Well, I'm very glad that you are here.
Aura Biosciences is a clinical stage biotechnology company focused on developing precision therapies for solid tumors that aim to preserve organ function. Our lead candidate, Belsar, is currently in late-stage development for primary choroidal melanoma and in early stage development in other ocular oncology indications and bladder cancer. Our mission is to grow as an innovative global oncology company that positively transforms the lives of patients. For more information, please visit us at aurabiosciences.com.
So one other thing that I did want to ask you about that Claire and I had talked about was that sometimes chemo can be classified as a brain injury. And I had never heard that. Now, ocular melanoma, chemo is not widely used, but some of our patients also have other cancers or reasons that they do have chemo. So for someone who's going through chemo, what does that look like? And are there any things that they should know?
The term that I often hear used and people have mixed feelings about it is called chemo brain, which the chemotherapy, of course, is a chemical that affects the brain and damages the brain while someone is going through chemotherapy. And the end result is that there's some damage done there, and it can also alter it can alter a lot of their ability to process. It can alter their cognition. They may be fatigued a lot quicker than they used to be and not have a lot of energy. And a lot of people think, oh, that's the cancer that made me this way. But oftentimes it is the chemotherapy that has affected their brain in such a way where they're moving a lot slower, they're processing a lot slower. They may have more headaches, more dizziness, more fatigue. It might even change them emotionally. They may be more angry in some ways because of the way it affected their brain. And we always say that no two brains are alike, so no two brain injuries are alike. So for everybody, it's going to look different and be different, and their journey is going to be different.
I wonder if this is something that just needs more research. We work with the Virginia State Legislature, and we also go to Capitol Hill, and we talk about the importance of research on brain injuries, their causes, and repercussions. So, I think this is an area that definitely is in need of more study. I think, Claire, you're right. There's a lot of people that do talk about this chemo brain thing, kind of maybe similar to, so many of the things that were coming out during COVID when we were all dealing with new impacts of disease that we just don't really understand yet and know everything about. So that is something that I hope might be somewhere in the research down the line so that we can understand what the chemo drugs are actually doing to people's brains.
Yeah, that's fascinating. So if you were going to talk to a population that had been through chemo, are there any things that you would tell them to look for and maybe seek out services like yours if they were feeling certain things or noticing symptoms?
How do we get our best health care? It's when we speak up, right? Right. So I think if somebody has experienced chemotherapy and is struggling and is feeling continued effects of that, and maybe it's impacting their vision, it's impacting their headaches, don't just blow it off as, oh, it's just part of the recovery from my cancer. Keep pursuing this with your doctor and ask the question, could there be something going on in my brain? Should I see a neurologist? Should I talk to people in the brain injury community? The answer should be yes.
Absolutely. And I think that a lot of the time, patients, when they're on these cancer journeys, they don't just have one doctor. They have a team of doctors. So you have your primary, your oncologist, your, XYZ, the list goes on and on. And so to add in a brain specialist, it might be a good idea when you're building that team to have somebody to just kind of check in and make sure like everything is going okay. And if it's not going okay, having that recognized is going to help you get the proper treatment. And then is there anything that say after you got the right treatment for that, are there any classifications that would maybe help you to acquire the right services or anything along those lines?
There could be, right? But we just don't know that yet. I think what the research could provide is a better understanding of, are there particular markers for chemo leading to brain issues, and what are those particular brain issues? If those markers are seen, or we're seeing, in the scientific research world, they have to look at a certain number of people kind of presenting with the same or similar things to really be able to study it well and then make those kinds of determinations. But I think what we'd be looking for is how many people are impacted, and is it the same drug that's being used? Is it different drugs that are being used? Is it length of a particular drug? Is it a particular type of cancer? There are so many variables that have to be examined before I think that they can have any consensus that there's brain injury because of chemo drugs. I personally just don't know enough about that, how many different drugs there are, or how it might be metabolized by the individual, and what else might be happening within the body and the brain that leads to those effects. It sounds fascinating. Maybe I think I've always been a researcher or epidemiologist wannabe, but that's not my field. So I can't really go deeper into that because I just don't have that knowledge, but I'm fascinated by this. And I do think it's worth a lot of study. I'd love to see the NIH and the CDC and other national researchers working on this, because there could be some incredible outcomes and maybe a lot of help and support for those who I imagine must feel so frustrated. There's nothing worse than knowing something's wrong with your body and nobody's listening to you, right? It's kind of like, we're among women, menopause, right? For how many decades do people just brush that off? And now we know so much more. There are very real changes happening in the body and the brain. And the more research we know, the closer we can come to having, whether it's a cure or protocols or medications or therapies or whatever it might be, to help. Going back to how could we help those particular clients who do feel like they have chemo brain and issues, as long as they have a diagnosis from their medical provider that says you have brain injury, we can help them. But I imagine a lot of them don't have that diagnosis because that's hard to pinpoint from chemotherapy at this point.
But I think it's great that we're aware that it is a thing, because now going forward, if enough patients go to their doctor and say, hey, I think I have this, maybe then we could get the funding and the research to figure it out. Yeah. And then if they did get the diagnosis, maybe they would be eligible for more services, programs, medications, whatever it may be. Because that's the whole point,
couldn't agree more, right? Advocacy is how it's all done. It's how we've been working to get the funding that we need or other support that we need to serve our clients. But in any situation, it is always, when you advocate, when you talk, when you tell your stories over and over to people who will listen, to the people who are in the power chair, that place where they can make a difference, where they can allot funding, where they can look at a new research, talk to your local universities, talk to researchers who you may know, talk to your own doctor and tell them over and over that this is important to you, that something's not right about you or your friend or your sister or whoever it is. Always tell the story, because that's how we can create change.
I couldn't agree more. That was so well said. Tell us where people can find you.
You can find us on the web at braininjurysvcs.org. braininjurysvcs.org. We have several different offices in Northern Virginia. Our main hub is in Fairfax, near the Mosaic District, if that is someplace you're familiar with. But we see clients all over the Northern Virginia territory. We have an office in Leesburg for adult case management. We have an office in Winchester. We have 2-day programs. One is here in our Fairfax location and one is in Fredericksburg. So we really cover a lot of territory. So if you think we can be of help to you, please reach out. You can call us at 703-451-8881, and we will take your call. We will direct you to where you need to be, and we'd love to see you come in. And if you're somebody who may not be somebody with a brain injury, but you're interested in who we are and what we do, if you want to see our day programs, you want to see what it's like, you want to know more about what we're doing, we welcome you to come visit us as well.
Fantastic. And we will link all of that in the show notes. So if you want to find their website and their phone number, just pop over to the show notes and you can grab it there. Ladies, this has been wonderful. I've learned so much, and I really just appreciate your time and all of the expertise that you've shared with us.
Well, thank you so much, Megan. It's been a pleasure, and we're always happy to share information because a lot of people don't know about us. And we also would like your viewers to know that if you're not in our territory, but you're in Virginia, there are similar programs throughout the Commonwealth of Virginia. So if you don't know how to find them, find us. We'll direct you where to go. If you are not in Virginia, there are similar programs in some states, or you can connect through your Brain Injury Association. There's a Brain Injury Association of America, BIAUSA.org, and each state has their own Brain Injury Association. So for us here in Virginia, it's the Brain Injury Association of Virginia, BIAV, but they're also a great resource, and they can point you back to an organization like ours or find you what you need in your state.
Well, thank you, ladies, and thank you to our sponsors. We could not make this podcast without our viewers tuning in, so thank you to you for being here and watching. If you're watching on YouTube, please hit subscribe. If you're listening, you'll find us on Apple, Spotify, Podbean, and anywhere else you get your podcasts. And we really do appreciate subscribing there. Please leave us some likes and comments. It all really does help. That drives our sponsors, and that provides this free education for you. So please continue to engage with us. Thank you to the sponsors. Thank you to our guests. We couldn't do any of this without all of you. We're a community, and we're all important to this process. So we just want to say we appreciate you, and thank you for being here. And we'll see you next time.
Thank you so much, Megan.